Taking a shower or a bath is an important daily routine to keep us clean and comfortable, especially in a humid environment. But for people who are bedridden, they need to take their bath in bed with the help of a caregiver. In this presentation, we will show you how to bathe your patient and attend their hygiene needs. Before start bathing, keep the doors and curtain closed to maintain privacy and make the room warm by turning off the air conditioning to prevent chills. Okay, before we get started, always perform hand washing technique and proper hand rubbing. We are using the clean technique in this procedure. Next, you should always know the materials we're going to use for bed bath. And here are the list: basin, bath cloth, soapy water, bath blanket, warm water, and bath towel. Let the patient know the procedure you're about to perform. Place a bath blanket on the patient to provide covering, and carefully pull out the linen and dump it on the laundry hamper. Next is to remove the clothes or the gown of the patient, and remember to untie the strap at the neck part of the gown. Bathing always starts from clean to dirty. In a small basin, wet the bath cloth with warm soapy water and begin cleaning the face, eyes, and ears. And then move on to the chest and abdomen. And remember, each time you switch location, you have to change washcloths.
Place a bath towel lengthwise under the arm and hand of the patient. Pay attention to the armpits and forearm because it's more prone for perspiration. Repeat the procedure on the other arm. After the upper extremities are done, we can move on to the lower extremities. Place a bath towel lengthwise under the thighs and legs. In this care, we're going to work on the thigh, going to the feet, because the feet are the dirtier part. We're going to work on a long firm stroke. This really helps to improve blood flows that provide comfort to the patient. Remember, if the patient has a red area or sore part of the skin, don't massage those areas. Just use a light touch instead. If the patient has diabetes, make sure to dry the skin. and pay attention to any possible skin ulcer or wounds. Repeat the procedure on the other arm. Put the patient on a lateral position. Assist the neck and the shoulder towards the edge of the bed, and lift the legs to the side. Gently roll the body and ask the patient to brace his arms to the side rails. Then wash the back, going to the buttocks. We can now move on to perineal care. We are going to put the underpads in the patient's lower extremities. And cover the patient's perineal area with bath towel or bath blanket to provide privacy and keeping the dignity of the patient. Now, we are folding the corners of the bath towel to expose only the lower part of the body. Asking the patient to relax a little bit. Now, we can proceed cleaning the perineal area. We will begin by scrubbing the pube area with one-way stroke from clean going to the dirtiest part. Now, we're going to spread the vagina opening of the patient and scrub the labia majora. Next is to scrub the labia minora. Scrub the clitoris, going to the rectal area, reaching as far as I can. Assist the patient to move in a lateral position, asking to brace her hands on the side rails for more stability. Scrub the rectal area with one-way stroke. Now, we are focusing on cleaning the pubic area first. And before we do that, make sure to clean the washcloth first. And now, we can proceed. Make sure to wipe this area in a one-way stroke and use 4 different sides of the washcloth for each stroke In this manner, we are avoiding to spread the microorganisms. In this scenario, my model has no foreskin. For uncircumcised male, make sure to retract the foreskin backward and clean the glans penis or the tip of the penis. Now, we can pull the penis upward and wash the scrotum area. I will make sure to wash the peri area as far as I can and reach down to the rectal area as far as I can. And if the male peri area is circumcised, make sure to wash the corona and the body of the penis. Explain to the patient the procedure you're about to perform, why it is necessary, and also to assess what specific product of shampoo or brand prepared by the patient, and ask the patient to cooperate whenever possible.
Okay, before we get started, always perform hand washing technique and proper hand gloving. We are using the clean technique in this procedure.
Next is, put bath blanket on the patient for cover to keep the privacy and dignity of the patient. Assist the client to the side of the bed. Position and prepare the client near to the edge of the bed from which you will work. Place a shampoo basin under the head, putting a folded washcloth or pad where the client's neck rests on the edge of the basin. To start shampooing the hair of the patient, wet the hair of the patient thoroughly with warm water. Apply shampoo to the scalp of the patient and make a good foam with the shampoo while massaging the scalp with your fingertips. Rinse the hair thoroughly with warm water to remove all the shampoo. Glide your palm to the scalp of the patient to squeeze as much as water as possible. Place a bath towel under the head of the patient and remove the shampoo basin. Assist the patient to a comfortable position. To dry the hair thoroughly, wrap the patient's hair with a bath towel. Use hair dryer if it is available. Arrange the hair using a clean brush or a comb. Document the bed shampoo procedure and write all the materials used. This documentation can be helpful for future assessment.